Greetings to you all. Today, I want to explain the difference between fenbendazole and albendazole, how they work, what parasites they target, and why albendazole is necessary when treating tapeworms, particularly when there's a concern for larvae and the brain. In my parasite clearing journey, I learned something very important, and it's something I rarely see explained clearly. Fenbendazole alone is not enough. And when you bring Praziquantel into the picture, albendazole becomes critical, especially when we're talking about tapeworms and larvae. This video is educational only, based on research and personal study, not medical advice. Always consult a qualified medical professional. Fenbendazole belongs to the benzimidazole class. It disrupts glucose uptake in parasites and creates starvation. It is primarily effective against adult intestinal worms. However, it has limited systemic absorption. It does not reliably cross the blood-brain barrier. Fenbendazole works well in the gut, but its reach is limited. Albendazole is a same drug class but has a very different behavior. It converts in the liver to albendazole sulfoxide. It reaches tissues, organs, bloodstream, and crosses the blood-brain barrier. It targets the larval stages, not just adult worms. The larval can migrate to the brain. Albendazole is the drug used when parasites are no longer confined to the intestines. Tapeworms are not like roundworms. They produce eggs and larvae, and they can migrate outside the gut. They can even attach and form cysts in the tissues. They can live in your skin. Tapeworm larvae can reach the brain and cause neurocystic urcosis. Some of the most common symptoms of tapeworm infection are chronic fatigue, unexplained neurological symptoms, seizures or headaches, pressure sensations in the head, and mood or cognitive changes. Tapeworms can also cause autoimmune and I believe autism-like behaviors. It can also cause a lot of nutrient deficiencies. Praziquantel is a powerful tapeworm killer because it causes worms to detach and disintegrate. However, it does not kill larvae. The risk is when Praziquantel kills adult tapeworms, the eggs and larvae may already be present. The larvae can migrate and inflammation can increase. There is a neurological risk if the larvae reaches the brain, and this is why albendazole is needed when you take Praziquantel. Albendazole targets the larval stages and is used in clinical settings for brain cysts. It complements Praziquantel's action. Fenbendazole works best on adult intestinal worms. However, its limited systemic reach is not sufficient for tapeworm larvae brain involvement and tissue-embedded parasites. This doesn't mean fenbendazole isn't valuable. It just means it's incomplete. In my research, I don't see these as competing drugs. I see them as tools that cover different stages. I use fenbendazole for adult intestinal worms, albendazole for systemic and larval stages, and Praziquantel for tapeworm destruction. This is why I believe full recovery requires addressing every life stage, not just what's easiest to kill. In my next video, I'll be breaking down mebendazole, how it compares to albendazole, and why I believe all three have a role in complete parasite clearing. This journey has taught me one thing. Partial treatment leads to partial healing. More to come on the deep cleansing of parasites for true healing.